and welcome to Is This Teething? Today in our workshop what we're going to discuss are what's real teething, how the teeth actually come in, treatment for teething problems, and then dental care for your baby. So to start off with, what's real teething? Well, the American Dental Association says that teething begins around 6 months old and that symptoms can include fussiness, sleepiness, loss of appetite, and excessive drooling. Again, the American Dental Association notes that fevers, rashes, or diarrhea are not teething symptoms. So if your baby is experiencing any of those symptoms, it's typically not teething and might warrant a visit to your pediatrician. So when your child is teething, it's important to know that sometimes the gums can swell up to a point where you can actually see a bump in the child's gums, and the tooth can actually go up and then go back down, go back up, go back down, go back up, and then erupt. So what I'm telling you is that there are occasions where you'll see swelling on your baby's gums, and then the swelling will go away, and then it'll come back, and then it'll go away. And then eventually the tooth will erupt or break through the gum area. That is actually a fairly common thing that can happen with babies. So it's possible that you're like, I thought he was teething, but then his gums stopped swelling and now they're swelling again. It is common for that to happen with babies. Another thing to note is that a lot of individuals think that their baby is teething at 3 months. Well, it's possible your baby could have their teeth as early as 3 months, but it's not normally what happens. Typically what parents see at 3 months that they mistaken for teething is a child bringing a lot of things to their mouth, excessive drooling, and fussiness with their baby. Well, yes, those are signs of teething. However, at 3 months, they're also developmentally appropriate signs that have nothing to do with teething. The reason that you see your child bringing things to their mouth more often is because they're becoming they have better control of their hands, and they have finally figured out how to bring their hands to their mouth. So, thus, they're going to chew on their hands or objects more often. And when there are objects in their mouth on a more regular basis, they're going to drool more. And that's why you see the excessive drooling. So you might be asking, well then why is my baby fussy? Well, at 3 months, your baby is actually starting to grow some more socially, emotionally, and is not as easily entertained as he was under 3 months. He needs more interaction from you and more stimulating activities than what he had prior to that. So that's typically why around 3 months you see them bringing things to their mouth, excessive drooling, and more fussiness, even though it's not teething at that point in time. So how do the teeth come in? Well, the general guidelines are that your baby should have at least one tooth cut through or erupted from the gums by age 1. Some babies do have their teeth cut after age 1, but if your baby hasn't had any teeth come in by age 1, I would recommend that you do a visit with your pediatrician or maybe set up an appointment with a pediatric dentist just to make sure that everything is going a-okay. So when the teeth come in, between 6 and 14 months, you're going to see the front 4 teeth come in up on the top and or on the bottom as well. And then the cuspids and the first molars come in by age 2. And then the second molars appear in the mouth between ages 2 and 3. On to treatment for teething pains. One thing I'm always going to recommend are natural treatments over-the-counter pain relievers, just to start off with, because if you can find a way to naturally reduce your child's teething pain rather than going to drugs, over-the-counter drugs, safe drugs but still over-the-counter drugs, it's always a better route to go, because then you don't have to worry about there being an allergic reaction, you don't have to worry about possibility of overdosing, or even just the fact that some kiddos, pain relievers can be a little tough on their tummy. If you're able to do natural remedies first, then you're able to, a lot of times, circumvent those complications that can arise. So a big suggestion could be to use pressure points. The pressure point on the toe, where the toe meets the foot, squeezing that with some deep pressure and wiggling back and forth has actually been shown to relieve some teething pain. Another suggestion is a wet baby's washcloth. You can use a regular washcloth too. The baby ones are just lighter, so they're able to manipulate a little easier. So you could just put the washcloth, dip it in some cold water, and then let your baby gnaw on it, or even bring it back and forth and massage your baby's gums. Some babies like to have something a little bit harder, so on rare occasions I would actually dip my child's baby washcloth in water and then put it in the freezer. But for the most part, babies tend to prefer the chilled versus the frozen of the wet washcloth. Another option is chilled carrots. The long carrots, not the baby carrots. Chilled carrots, again, give them the sense of deep pressure on the gums and give them something that they can actually hold and manipulate on their own and chew on as needed. If for any reason your child is able to bite through the carrot, you need to take that piece that they bit through and make sure the next piece is at least as long as their finger to the bottom of their hand so that they have enough distance to hold on to it without it being a choking hazard. Another option that I have a lot of parents that have enjoyed is putting frozen fruit inside a washcloth or a baby washcloth, wrapping the fruit in the washcloth and letting their child chew on it. A lot of times the sweet taste of the fruit gives them the initiative to keep chewing on it, and the frozen cold coming from the frozen fruit helps with the relief of the teething pain. Another option is your run-of-the-mill teethers that you can get anywhere. You can either put it in the fridge or in the freezer. You're going to have to figure out what your child prefers, frozen or chilled. Again, most babies prefer the chilled options. Another thing that's becoming a lot more popular these days are amber necklaces. They can be purchased at a lot of different stores, and it's a necklace that your baby would wear that is made out of the gemstone of amber. And it actually, in many circles, individuals feel like it helps a lot with teething pain. Another option is just your clean finger. Your babies love to chew on those. So wash your hand and then give your child your finger. Again, you can rub it to massage the gums, or just let them go at it, and they'll even hold your hand and move it to where they want it to chew on it to help with that relief of pain. Another option is chamomile mixed with water. You can get those at a lot of health and food stores. Again, there's hardly any chance of any difficulty with your child when you're using the chamomile because it's very gentle on the stomach. And then, of course, there's also the homeopathic teething tablets. When you move towards the homeopathic teething tablets, we're moving back towards the over-the-counter drug and pain medications like Tylenol, ibuprofen, or gel. They're all things that you can use for your child. Really, when it comes to the teething, it's going to be a guessing game on what works best for your child and for you as a parent with your comfort level. So our last area we're going to discuss about is dental care for your baby. A lot of individuals aren't quite sure when they need to start getting dental care for your baby. Well, it's important to start early. What that means is that we suggest that you start cleaning your baby's gums as soon as they start eating solids. So on a regular basis, start massaging your baby's gums. As soon as they start with the solids, what I liked to do a lot with my children was to take a washcloth, dip it in water, and just rub the gums once on the bottom and once on the top every day. That really didn't do much for cleaning the gums. What I was actually doing was giving them some massaging for any teeth that were coming in, but I was also trying to start the habit of them getting some sort of cleaning done to their gums on a regular basis, so that when they did start to get teeth and we did need to start teeth brushing, it was no big deal to them. They had been having their gums cleaned on a daily basis since 6 months old, so there was no real fight there. So if you decide not to use the washcloth for cleaning the gums, another great option is the tooth glove. It's just a little silicone glove that you can put on your finger, and it has a bumpy side for massaging and then a little bristle side to help clean the gums for your child. This is a great first toothbrush. Again, you can start this as young as 6 months with your child, just doing a quick sweep in on the bottom gums and top gums every day. And Safety First actually has this great kit where it comes with the little glove and then moves on to the toothbrush for when your baby does start to get their first teeth, and it has a great little carrying case for this as well. The American Dental Association recommends that as a parent, you take your child in when they first have teeth cutting through or erupting from the gums, or at a bare minimum by their first birthday. The American Pediatric Association recommends that a child see the dentist by age 2. You can really go with whatever your comfort level is there, but for the most part, the reason that the American Dental Association recommends by age 1 is that by age 2, your child has seen their pediatrician almost 12 times. So they have a very relaxed relationship with their pediatrician. You have a relaxed relationship with their pediatrician. Your child is used to seeing their face, they're used to being examined. The dentist isn't quite so lucky. So it kind of helps build that relationship with your child with the dentist. It helps you as a parent to build that relationship with the dentist, to get into the routine of taking your child to the dentist for checkups. And it also helps a lot with prevention. If the dentist starts to see any issues with the teeth not coming in well, or maybe just needing to give a couple little pointers on dental care and how to make sure those teeth are kept clean, starting early helps out a lot to create really good habits. A resource for you in terms of where to take your child, there are pediatric dentists throughout the country in all cities. So you can see a pediatric dentist or a regular dentist. Another fun note is that a lot of dental schools actually offer reduced fee or completely free dental clinics for children under the age of 2. Check around in your local area to see if those are available to you. Thanks today, and I hope that you got a lot of information about whether or not your baby is teething.